Good morning. Today again I'm going to give you some updates on the health-related relief efforts and the general health situation in Haiti. There are now more than 50 teams from different countries and organizations providing health services to the sick and injured Haitian population. There are now 40 functioning facilities in Port-au-Prince, including the 8 field hospitals from different countries around the world and organizations. The French field hospital is delivering obstetric care. The Brazil field hospital is providing neurologic and facial surgery, and Russia is providing orthopedic surgery. The USNS Comfort ship is operating with its 1,000-bed capacity, and a team of 20 trauma experts arrived from Mexico. PAHO software, SUMA, for managing humanitarian relief efforts and supplies is functioning at the airport in Port-au-Prince, and DHL, the shipping company, is helping to support that system. We know there are about 60 spontaneous settlements in Haiti with about 1 million people in them. This is according to our partner, the Red Cross. Coordinating relief to such settlements is a top priority. There has been progress getting safe water to people. We now know that 75 to 80 water distribution sites are currently serving about 130 to 180,000 people each day. In addition, the U.S. military said that yesterday they distributed about 1.4 million bottles of water. And the Red Cross is providing water to 12,000 people in 3 of these settlements. There are many others who are distributing water along with food, but there still remain gaps. We understand that Cité Soleil, the capital's poorest neighborhood, is facing critical water shortages, so attention is being directed there. In the area of sanitation, PAHO WHO is working with the Haitian authorities to collect and safely dispose of hospital waste and waste from the public latrines. UNICEF and others are building new latrines, and other organizations and countries, including Dubai, are sending water treatment and sanitation equipment. The American Red Cross is sending donated blood to Haiti in coordination with PAHO WHO and the Dominican Republic's National Blood Program. The Dominican Republic is receiving patients requiring longer-term post-operative care, such as patients who've had or underwent amputations who require special follow-up rehabilitative care. As of today, PAHO WHO has channeled over $12 million in cash and in-kind contributions to Haiti from countries and partner donors. We've also learned that the United Nations Development Program has started a Cash for Work program to help the local economy. They are hiring Haitians to clear and repair streets, restore electricity, and other activities. At this point in the relief efforts, our top health priorities remain treating people with crush injuries, fractures, and lacerations, and providing the necessary post-operative care, and preventing conditions such as acute malnutrition and dehydration, while also ensuring basic supplies are there like food, water, and importantly, security. Untreated trauma wounds and infection of wounds are emerging as major health challenges that need priority attention. We've talked about Haiti prior to the earthquake being the poorest country in the Western Hemisphere, with especially a vulnerable population. Poverty breeds ill health, so our Haitian neighbors are vulnerable to a number of adverse health conditions. Even under normal circumstances, medical care is inadequate, and there is a significant risk of infectious diseases, especially from waterborne pathogens. To prevent the spread of waterborne diseases during this critical time, safe water is being provided and distributed, as I mentioned. But this needs to be sustained while systems are being rebuilt during the reconstruction phase of the response. Affected populations are at risk of moderate and severe acute malnutrition, especially in vulnerable groups such as young children, pregnant and lactating mothers, and the elderly. The risk can be increased by the lack of support for breastfeeding and complementary feeding for mothers or their caretakers. With water and sanitation systems disrupted, it becomes even more critical to promote breastfeeding for mothers so that rather than formula mixed with contaminated water, their children remain healthy. In the aftermath of disasters, we know women and children are particularly at risk. We hope and pray that the security can prevent and control violence against women, an unfortunate consequence of some disasters. We know that the rates of violence against women were already high in Haiti before the earthquake. A recent study showed 1/3 of women had suffered physical or sexual violence, and more than 50% of these were girls under the age of 18 years. We also know from past experience that vulnerable groups like women, girls, and children do not get the relief aid they need unless we are all proactive and make special efforts to reach out to them. So with that, I think I will end, and I am happy to entertain any questions or comments, and thank you all for coming.